Dr. Burbacher is professor in the Department of Environmental and Occupational Health Sciences at the University of Washington in the School of Public Health and Community Medicine. He is the co-director of the Pacific Northwest Center for the National Children's Study. He's also the head of the Division of Reproductive and Developmental Sciences and director of the Infant Primate Research Laboratory at the Washington National Primate Research Center at the UW Center of Human Developmental Study, Human Development and Disability. Dr. Burbacher has been involved in research in the area of mercury developmental neurotoxicity for several decades, was a member of the 2000 National Academy of Sciences panel on methylmercury. He is the lead author of a recently published study comparing the absorption, distribution, and metabolism of thimerosal and methylmercury in infant non-human primates. He is a member, as I mentioned, of the IAOMT Scientific Advisory Committee. Please give a warm Academy welcome to Dr. Tom Burbacher.
As I mentioned, I was asked to go to a meeting at the National Institute of Allergy and Infectious Disease in about 2000 and talk with them about what kind of research program that they might put together using animal models to look at thimerosal in its developmental neurotoxicity. And out of that meeting, we were able to do a study. And my experience with that study and the aftermath of that study sort of makes up the talk that I'm giving this morning. It was very interesting in terms of how the study was published, how it was interpreted, how it continues to be interpreted by many different people in many different ways. So that's going to be sort of the talk today. So I want to start with a little film here just to, and I know you all know about the thimerosal issue. Is this going to work?
Autism. The diagnosis rate has gone from 1 in 10,000 births in the 80s to 1 in 166 births in 2003. Why the increase? What's the cause? Why is there such controversy with charges of a government conspiracy? With us, the president of the Institute of Medicine, Dr. Harvey Feinberg, and the author of Evidence of Harm, Mercury in Vaccines and the Autism Epidemic, David Kirby.
Okay, so as I mentioned, I came about into this area because of my research in methylmercury, and I've been doing methylmercury research for about 20 years. And that was fairly controversial in terms of methylmercury neurotoxicity and the kinds of safety standards we should have related to that because it affects how much fish you can eat during pregnancies. But I never knew controversy until I got into this area. So it did give me some practice for this, but I don't think I was aware of what I was getting into. So with the introduction, you can see here, and Dr. Haley mentioned too, that there is a very huge controversy. One that it seems very similar to one you're dealing with in terms of amalgams that has been going on for probably over a decade now, where various autism groups, we mentioned Safe Minds earlier, National Autism Association, Defeat Autism Now. These are families who have kids with autism who feel that the vaccines that their kids were given has something to do with their autism, and they've been fighting like hell for the last decade to get somebody to notice them and to actually increase the amount of spending on autism research. If you look at the past decade, the amount of money on autism research has been very, very low compared to some of the other developmental disorders. On the other side of the controversy, and David Kirby, actually now has this book out for the last few years that actually chronicles the fight that these families have been in. The other side of the equation is the Institute of Medicine, the CDC, the FDA, and their folks in terms of how to keep the message out that vaccines are good for you, that vaccinating your children, keeps them from getting terrible diseases, and how do you do that in relation to, how much thimerosal is in the vaccines and how many other reactions you can have. So I wanted to, you probably don't need this, but I just want to give you a little background on autism. This is from the CDC website. It's a group of disorders known as autism spectrum disorders, developmental disabilities that cause substantial impairments in social interaction, communication, presence of unusual behaviors. So it's a large spectrum of disorders. It's not just one disorder, and you probably all know that. What causes autism? I think Boyd and I would agree that actually genetics does have something to do with autism. It's not a genetic disease, but most people think that there is an interaction between genes and environment that play a role. Studies have shown that among identical twins, if one of the child has autism, the other one would be affected 75% of the time. If non-identical twins, it's 3%, and parents who have a child with autism are more likely to have a second child, 2 to 8% chance of having an affected child. Now, we don't know what genes are involved, and if it's a purely genetic disorder, those percentage would be much higher. But there is some genetic component to this disease, and I think most people now think that there is an environmental component to it as well. We just don't know what that is. For decades, autism was believed to occur at 4 to 5 per 10,000. In 2004, the American Pediatrics put out an autism alarm. Different studies were showing that's 1 to 166 or 6 in 1,000. So the rates have gone up precipitously during the 1990s, and the rates now are much, much, much higher than they were in the past. We all know what thimerosal is. Breaks down by ethyl mercury salicylate, thiosalicylate, and that's 50% mercury by weight. This is a mothering magazine, Mercury in your vaccines. I think a lot of people at that time didn't know they were there. This is the vaccine schedule, and you can see during the first 6 months with the Hep B, the DTP, AB, and the influenza vaccine all had mercury in it. So this is what was in the vaccines prior to 2000. And the dose that was related to those vaccines was compared to what kind of a standard we have for methylmercury. And this was done during the 1997 FDA Modernization Act. It was an act passed that looked at all the different things, all the different chemicals and all the different treatments that kids were getting to see what kinds of chemicals were in those and to compare those to any kind of safety standards that we have on those chemicals. So the question is, why is there a safety limit for methylmercury exposure, and what does it have to do with vaccines? The safety standard that they had for mercury was just for methylmercury. We didn't have any standards for ethyl mercury, which is the thimerosal mercury. So when you compare what the kids got in their vaccines to methylmercury, it was over the safety standard for what we have for methylmercury. And you all know about methylmercury and Minamata disease. And the reason we have safety standards for methylmercury is starting with Minamata over several decades. We've had human studies, animal studies, cell culture studies, in vitro studies that give us a fairly good idea as to what kinds of effects you get with in utero and early postnatal exposure to mercury. There's still a lot we don't know about the mechanisms of those effects. But we do have some data indicating that certain exposures will cause neurodevelopmental effects. And that data, is what we reviewed in 2000 when EPA decided to lower the safety standard for methylmercury. This was very controversial at the time. The states that had the coal-fired plants didn't want this to happen. The states that got the effluent from the coal-fired plants wanted this to happen. So there was a big problem in terms of passing this legislation. This was in the late Clinton administration. So it was held up for Congress for many, many years. So like a lot of things that happened in Congress, when they couldn't get past an impasse, they gave it to the National Academy of Science to look at to see whether or not this lowering of the standards for methylmercury was actually scientifically sound. And it was mentioned I was on the panel of experts that reviewed this, and we felt that there was enough data to lower the standards, and the standards were lowered. The standards are pretty much based on neurodevelopmental effects in children due to prenatal exposure to methylmercury. And the main study that was used, although these standards are based on what's called a weight of evidence, was the study from the Faroe Islands. But if you look at the support information from other studies in humans as well as the animal literature, the new safety standard of 0.1 micrograms per kilogram per day was actually a reasonable standard. If you actually didn't have any human data and you used just the animal data, which 99% of our standards are based on, it would be actually about half that, so the standards would actually be even lower. So what does that have to do with vaccines? Well, during the same time when that came out in terms of having a higher dose during the first 6 months than what's allowed for methylmercury, there's also data that came out looking at the rising levels of mercury in vaccines and in the autism rates during the 1990s. And obviously, if you see these two things, it wouldn't be too much of a stretch to ask yourself whether or not they're actually related, which was what was done. In 1999, a statement from the American Academy of Pediatrics and the Public Health Service concluded that thimerosal containing vaccines should be removed as soon as possible to reduce exposure to mercury. Okay, so the review in '99 indicated that we should be practicing the precautionary principle, which you've heard about this morning, and I think you probably all know what that is. The statement indicated that there was really no evidence at that point indicating that kids were being harmed. But it says, nevertheless, because any potential risk of concern and vaccine manufacturers, because of any potential risk of concern, the Public Health Service and the AAP and the vaccine manufacturers agree that thimerosal containing vaccines should be removed as soon as possible. So they were practicing the precautionary principle, which was, I think, a very nice thing for our government agency to do. They don't do that very much. So that's when I was asked to come to a meeting at the National Institute of Allergy and Infectious Disease to look for the goal of what kind of studies can we do in animal models to start getting sort of a weight of evidence for thimerosal or ethylmercury in terms of developmental neurotoxic effects. And the first question I asked was, what do we know about what happens when you inject mercury into an infant, either a human or an animal? And somewhat to my surprise, the answer was very little. We had some information on delayed type hypersensitivity in humans. Boyd talked about these acute poisonings in humans. But very little was known even about how much mercury is in the body of infants once they get these shots. The only study I could find was one study looking at a newborn and a preterm infant after they get the Hep B vaccine. And you can see here the difference in the full-term infant and the preterm infant is quite dramatic. So that's the only data I could find that even looked at what happens to thimerosal when you get actually a vaccine. So we actually started with that question. How can we provide some information as to where actually the thimerosal, where the ethylmercury goes once you get an injection? And because we were comparing it to methylmercury, we did a direct comparison of what happens with when you vaccinate infant monkeys with when you give them oral methylmercury, to see whether or not using this mercury standard, this methylmercury standard, is something that actually is valid. So we used the vaccine schedule. So we vaccinated the monkeys 4 times over the first 1 to 3 weeks of life. We gave the vaccines a week apart. There's lots of data that shows that that monkeys develop around 4 times faster than human babies. So there's like a 4-to-1 ratio. So we're looking at the 4 shots, the first 4 shots that human babies get, and then looking to see after each shot how much of the mercury goes into the blood, how much clears the blood before you get to the next shot. And then we gave the next shot and did the same thing in the next shot. And then when we were finished with the vaccine schedule, we looked at how much mercury actually was in the brain. We also looked in the kidneys, but most of the focus was on the brain. We used 20 micrograms per kilogram because if you look at the sort of a range of doses for humans, 20 is pretty near the top. So we were looking at sort of the 2-month associated dose. So what do we find? We found that mercury accumulates in the blood following weekly methylmercury exposures, and that accumulation continues week after week. So you get very, very little clearance. Whoops, that's not one. You get very little clearance of total mercury in the blood. So this is the first exposure to methylmercury. You get this bump up. You get the next exposure, bumps up, bumps up, bumps up. So each time you're given the other exposure, you get an increase. So you get very little clearance. So that by the time you're finished with the exposure, you're up to about 40 micrograms per mil. And then you get this clearance over the next 20 or so days. Unlike methylmercury, when you give thimerosal shots, you get this increase up to about 10 micrograms per mil, and then you get a pretty quick clearance down to about 4 by the time you give the next shot, and then you go up again, down, up and down. But if you see the peaks over the 4 times that the shots were given, they're not really rising very much, so they're rising a little bit. So you get very little accumulation in the blood, and you get fairly quick clearance. And as you see over the 20 days afterwards, it goes down to almost 1 or 2. So there's very different clearance mechanisms that are going on when you compare methylmercury to ethylmercury. Okay, they're both organic mercuries, but one of them actually clears the blood quite a lot faster than the other. Then as I mentioned, we looked at the total mercury levels in the brain. If you look at what's in the brain after all the shots have been given, the amount of total mercury in the brain is much higher following the methylmercury exposure. So you're up to about 100 nanograms per gram over the 2 days after the first shot, 4 days, 7 days, and 28 days after the first shot, or the last shot. Okay. So this is the methylmercury group. This is the IM thimerosal group. So the total amount of mercury that you get in the brain is much, much higher with this methylmercury exposure than it is with thimerosal ethylmercury. And we barely, I think, really had the data to do these half-lives, but we did them anyway. If you look at the methylmercury, it's really not dropping very much at all in this amount of time. So this half-life is not very good, and you can see what the standard error is, or standard deviation. The thimerosal, there's a little bit better, but it's basically based on this last data set, which is 28-day, to show that it does go down by 28 days, and it has basically a much faster half-life that's coming out of the brain. Okay. Now, because we had done a previous study with methylmercury exposure in adult monkeys, we were one of the first ones with folks in Sweden to actually report that when you have mercury in your brain from methylmercury exposure, if you wait long enough, quite a bit of that mercury will demethylate and turn into inorganic mercury. And what we found actually in that study was that the inorganic mercury in the brain had a half-life of probably over a year or 2. We didn't actually do the study long enough, and you'd have to do a 10-year study to actually get a half-life for inorganic mercury in the brain. It doesn't actually go anywhere for a long, long time. We also looked at what kinds of cells changed in the brains for these animals and didn't find any effects on neurons, but we found a neural inflammation response in the exposed animals with an increase in microglia. And the places where those occurred actually was where the inorganic mercury was. It co-located with the inorganic mercury. So we proposed that if you're looking at maybe high doses of methyl mercury, high doses of mercury in the brain, you may get neuronal deficits, you may get neuronal death. But this may be a better model for what happens when you have much, much lower levels of mercury exposure, where you get, maybe one of the first things you get is this neuroinflammation response, maybe this increase in microglia. And that actually looks like it may be actually associated more with where the inorganic mercury is than where the demethylated inorganic mercury is than with the organic mercury itself. So when we did this study, we wanted to look at not just total mercury in the brain, because we think actually the inorganic acts differently than the organic. So we speciated the mercury in the brain and actually found that the inorganic mercury in the brain is much higher in the thimerosal animals. And this makes sense because the ethyl mercury actually breaks down much faster. So it produces inorganic mercury, not in the blood, but it actually produces once it gets to the brain. So our concern was that even though you have total mercury levels lower, the inorganic portion is actually higher. The absolute values of the two are quite different. This is 20, and the other one was 100. But this is much, much more inorganic mercury that you would get in your brain, even if you ate quite a bit of fish. Okay. The half-life, again, we couldn't estimate, and even our other studies, which were much longer than this, we couldn't do that either. The other thing we did is just look at this one here, is we looked to see whether or not there was a difference in how much mercury gets to your brain depending on what you have in your body, because there had been data, there had been comments about ethyl mercury being the more kind mercury, and that actually even if you have it in your body, it doesn't go to your brain like methyl mercury does. And we actually found that if you control for how much is in your systemic, how much is in the body, actually more of the mercury gets into your brain after your thimerosal shots. The brain-to-blood ratio is actually higher. So for a given amount of mercury, you'll actually get more in your brain after the thimerosal shots than with methyl mercury. Okay, so that took us about 3 or 4 years to do. Monkey studies are very long and hard and difficult to do. They take a long time. And during the time we actually did this study, several things changed in terms of the landscape, in terms of how we talked about vaccines and thimerosal. And some of this you've already heard, and I'm going to go through it pretty quick. But you've got first IOM report in 2002 looked at thimerosal and neurodevelopmental disabilities. So it was actually not just focused on autism, it was focused on broader neurodevelopmental disabilities. And the conclusions were the hypothesis of a link is biologically plausible. The current evidence is inadequate to accept or reject a causal relationship. And then the last one is additional studies are needed at all levels, epidemiology, clinical, and basic science. So that was the 2002 conclusion for the IOM. During the time that we were doing our study, several epi-studies came out and reported no association, and Boyd talked about these, and I'm not going to get into details of them. But these are the ones that are usually referenced now to show that there is not an association between thimerosal and autism. So I showed this because in 2004, we were still getting articles that indicated that, where is it? To date, one study measured blood levels, total mercury in vaccinated infants, and reported only brief, low-level exposure with rapid excretion of mercury. It is not yet known for sure how much, if any, vaccine-derived ethyl mercury in the blood crosses the blood-brain barrier. So still in 2004, we were questioning whether or not this actually even got to the brain. The other things that happened that were reviewed that happened after 2002 was that these articles that were coming out related to an excretion deficit in autistic kids. And again, Boyd talked about that, so I'm not going to go into it in much detail. I think he showed this slide as well. This is Jeff Bradstreet, who is a DAN doctor, Defeat Autism Now doctor, who went before the Institute of Medicine, showing them different excretion levels and urinary mercury levels for autistic and non-autistic kids. And this is Jill James' data indicating impaired methylation. I think you've heard about that a few times during during the talks to this meeting. So there was, new data in the EPI studies, new data in basic science studies, just like the 202 IOM report indicated should be done. And then when they came out with the 2004 report, it was really focused just on autism. And it indicated the conclusions, basically, epidemiological evidence favors rejection of a causality relationship between thimerosal and containing vaccines and autism. And then they came up with this new way of evaluating basic science studies and animal studies, calling them theoretical. Potential biological mechanisms for vaccine-induced autism are theoretical only, which means for this report, they should be dismissed, which was kind of strange. And I think that was the basis for this poor review that this report got that Boyd had mentioned. So the recommendations was to continue surveillance for autism exposure declines, increase efforts to quantify the level of prenatal and postnatal exposure to thimerosal and other forms of mercury in infants. And then they really did something I don't think they needed to do, but I think this is more of a commentary than anything else. Available funding for autism research should be channeled to the most promising areas, which was a sort of backhand way of saying, why don't we just stop talking about this? And a lot of people felt that that really hindered the further research in this area. So with that all going on, I published this in Environmental Health Perspectives. Someone mentioned that journal before. It is quite a good journal. Thimerosal in animal brains, new data for assessing human methylmercury risk. Says a sticky situation. New data show that using methylmercury as a reference for calculating risk for ethylmercury in vaccines may be fraught with problems. So basically what I concluded from the study was that there was some good news, but this really is sort of maybe good news. Lower total mercury levels in the blood following thimerosal exposure due to faster clearance. And as Boyd had mentioned, this could be good news or bad news depending on where it's going. The other thing that we found was lower total mercury levels in the brain following thimerosal due to the lower levels in the blood and a faster clearance in the brain. Then I talked about several concerns that we had. And one was that total mercury breaks down faster in producing more inorganic mercury. Inorganic mercury in the brain is a very long half-life. Unlike methylmercury, blood mercury levels won't be a good indicator, for brain mercury. So less neurotoxicity potential. So when people are now continuing to do studies that show blood levels in infants, it really doesn't really tell you very much, because due to the difference in how inorganic and organic mercury are excreted from the body, you're not going to get a good indicator of what actually is in the brain. Inorganic mercury in the brain has been associated with neuroinflammation in our previous studies. And we also indicated that, that study that had just come out indicated that there was neuroinflammation present in the brain of autistic children. So the bottom line was methylmercury is not a good reference for thimerosal risk. Lack of information regarding the neurodevelopmental effects of thimerosal actually is quite surprising given how long we've been using this and injecting this in kids. And thimerosal risk can really only be evaluated with research on thimerosal, which seems like a duh, but I indicated that research should focus on inorganic mercury neurotoxicity because we don't know very much about that. We really don't. There is a group that feels that inorganic mercury, because it stays in the brain so long, actually doesn't do anything because it's really tightly bound. And that may be the case. Our data would show that that's not the case. And also, factors that increase sensitivity to mercury neurodevelopmental effects should be looked at. So one of the things I wanted to go through is my experience actually post-publication in terms of, I don't know how much time I have, in terms of how this was actually treated in the press and other agencies. This is actually the press release that came out from NIEHS, which actually owns Environmental Health Perspectives. Reported Environmental Health Perspectives finds methylmercury not a suitable reference for risk assessment. Research uncovered greater detail about differences in how thimerosal a preservative used in vaccines since the 1930s, and methylmercury eliminated from the brain and body, as reported and published today on Online Environmental Health Perspectives. Among other effects, researchers found that brain concentrations of total mercury following thimerosal exposure were nearly threefold lower than those following methylmercury exposure. So, do you see anything missing? Okay. This was actually put out without checking with me. I called and asked them, why that happened, and they said it's never happened before. It's the first time it's ever happened. That they actually put out a press release without checking with the lead author. So I actually had them ask them to do another one, which kind of got lost in the shuffle. So this got out pretty quickly and picked up by Reuters. Mercury in vaccines different study shows mercury containing in some vaccines processed differently. Test in monkeys showed ethyl mercury contained in vaccines cleared quite quickly by the body, while methylmercury persists. Suggests that current guidelines of mercury exposure do not apply to vaccines. BBC picked it up. Blood fast to expel mercury jab. Mercury, which has been used in vaccines, stays in the blood for less time than mercury found in fish population. Researchers do not mean thimerosal was harmless. More research. Okay. And MSNBC picked it up. Mercury in vaccines different. Toxin and pollution stays in body much longer. Mercury contained in some vaccines processed differently in the body, possibly less toxic to children than mercury found in pollution in fish. So you can see this is sort of moving the goalposts as we go along here. And then that was picked up by most other outlets that I saw. Vaccine preservative, not as dangerous as claimed study finds. And this is the one that sort of went out to most outlets by the time it got out to most of the other outlets. May not be as dangerous as previously. Researchers concluded less toxic than methylmercury found in fish and pollution. Okay. All these outlets picked it up as well. So, in reading that, the autism groups were not very happy with how this study was being interpreted by the main press. So they put out a press release. Study shows ethyl mercury ends up in primate brains. Study shows ethyl mercury used in vaccines ends up in brains of primates. Environmental Journal puts a happy spin on results. Study says ethyl mercury is most toxic to the brain. National Association says journalist paints rosy picture on an ominous outcome. So we've got sort of the other side in, actually probably giving a fairly accurate view of what happened with the mainstream press. Not really sure why they needed to put that part in, since that's not what the study said as well. And then I talked to a folks from Oakland who just sort of decided he wanted a good lead for the paper, so he just put vaccine additive linked to autism for my study. And I called him and said, how did you do that after talking with me? That's not what I indicated to you. And actually his editor asked him to put a retraction in for the next day's paper. So one of the things I learned is once you get your data out there, you're never really sure where it's going to go and who's going to talk about it and in what way they're going to talk about it. So you just have to be very careful with these things. The other thing is no good deed goes unpunished. I got FOIA requests for all my data, for all my studies back into the 1970s from CNN when this study came out. We also have folks in Congress who are actually quite supportive of the autism group's search for an answer for this, and one of them is Dr. Weldon. David Weldon, who's an MD, he's a congressman from Florida. And he wrote this letter to the Secretary of Health and Human Services indicating that we really do need to get more studies done in this area, given the results of this paper. I was also asked to go and testify before subcommittee in Congress to talk about the study, as well as 3 or 4 other scientists, to give them some update on what was going on in 2004. World Health Organization asked me to talk with them. Unfortunately, they didn't send me to Geneva. I had to get up at 4 in the morning or 3 in the morning to do a telephone conference with them in terms of reporting on the study, but they pretty much dismissed it, indicating these are monkeys, they're not humans, so we really can't say much. Don't forget about the lawyers. I've been contacted by both sides of this lawsuits, folks that are defending the pharmaceutical industry as well as folks that are suing the pharmaceutical industry. I've also been contacted by the Justice Department in terms of the lawsuit for the vaccine court, as well as the folks that are defending the 5,000 cases in the court. So I'm an optimist. I think things can get better. And I think there's a lot of evidence that things are getting better in this area in terms of working with the autism groups, working with various groups to really look at what kinds of environmental factors might be active in these neurodevelopmental disorders. I think Boyd mentioned that it's not just autism that's gone up. All the different developmental disorders have actually increased over the last decade or two. So this is a symposium that was done in 2005 by Safe Minds, Sensible Action for Ending Mercury-Induced Neurological Disorders, and the National Autism Association. Neither one of them ever put on a conference before, and it was a wonderful conference. You should probably talk. You two groups should probably talk. I mean, they could probably learn a lot from you. You've been doing this for 25 years. So it was at the focus was environmental factors for neurodevelopmental disorders and symposium. And they had folks from the National Institute of Health there, actually, that listened quite readily to all the different presentations. So it was one of the first stepping stones of actually getting these groups into really putting on scientific conferences, having the National Institute of Health come and talk with them. Autism Advocate, Environmental Health and Autism 2006. So this is really now one of the focuses of a lot of the groups to look at these environmental etiologies. You've seen this already. More data is coming out that may indicate that these kids have trouble with not just mercury, but for a lot of different environmental exposures that might occur. This is another Jill James study as well. So this is from the Congress because we have what's called a vaccine safety database. And this is where the first CDC study came out of. So when they took Thimerosal out of vaccines, the question was, could this database actually be used to study whether or not we're going to get a decrease in autism rates now that Thimerosal is out of vaccines? What was interesting, though, is this came from 12 different senators to Dr. Schwartz, who was the head of NIEHS at the time. And it's interesting, in a letter, it says if the federal government is going to have a study whose results will be broadly accepted, such a study cannot be led by the CDC. It is for these reasons we believe that NIEHS is the most appropriate entity to lead this investigation. So it was, by this time, this was I think 2006. CDC had lost a lot of its credibility, even among other government agencies, for how they've handled this area. And NIEHS now is quite active in this area, National Institute of Environmental Health Sciences. So the panel was put together. I was on the panel. The meeting included scientists from outside agencies and representatives from different autism groups, and they were all sitting around the same table, which was really nice, because we had people who were pretty much in the margins for many years now at the table with NIH scientists. Panel reached consensus that the analysis comparing the rates of autism in the vaccine database over time period before, during, and after removal from most childhood vaccines would be uninformative and potentially misleading. And this is because it's the way that the data are collected. It's collected in different sites, different ways. There's no really standard operating procedures for doing this. There's no standardization of data quality, data, things like that. So we felt it actually wasn't going to be a very good exercise. In 2007, last year, the Institute of Medicine Forum on Neuroscience and Nervous System Disorders had a conference, Autism and Environment, Challenges and Opportunities for Research. sort of continue the dialogue. And again, this was attended by a lot of scientists as well as a lot of the folks from the different autism groups. In 2006, after many years of pushing Congress to do something, these groups were very instrumental in passing this Combating Autism Act in 2006, which really increased quite a lot the amount of funds that are now going into autism research, and including centers that focus on autism and not just focus on genetics, which is really where a lot of the research was going for many years, but now also focus on what the environmental influences are. So I updated this yesterday when this came out. Georgia Girl Helps Link Autism to Childhood Vaccines. You probably all saw this on the news, talking about this underlying disorder that this child has. No one so far has described what that was. They have described the child as being perfectly normal before the vaccines. So whatever the disorder was, no one knew she had it, including her. And it sort of goes back to, some of these other, Jill James research and the other research that's showing these kids, are having all these metabolic methylation problems. Could that be another underlying disease that's actually used to indicate that these kids were susceptible? This is actually what it said. In some, the Division of Vaccine Injury Compensations concluded the facts in this case meet the statutory criteria for demonstrating that the vaccines child received in 2000 significantly aggravated an underlying mitochondrial disorder which predisposed her to deficits in cellular energy metabolism and manifested as a regressive encephalopathy with features of autism spectrum disorder. See, they did not want to connect the vaccines right to autism, so we have all this stuff in the middle. Therefore, the respondent recommends that compensation be awarded for petitioners. And I'll just come sort of full circle here. I mentioned David Kirby at the beginning. This is how he responded to this. Government concedes vaccine autism case, federal court, now what? The key words are aggravated and manifested. And he says, when a kid with a peanut allergy eats peanuts and dies, we don't say his underlying metabolic condition was significantly aggravated to the extent of manifesting as an anaphylactic shock with features of death. No, we say peanut killed the poor boy and removed the peanut from the equation, and he would still be with us today. So I think it's a good question. Government concedes, now what? It's going to be very, very interesting. A lot of these other cases are going to come around in May, and my guess is that quite a few of the kids are going to be seen by physicians looking at these methylation issues, and I think it's going to be quite interesting to see how all that goes. So I have to apologize. I'm actually not going to be here for the speaker forum, and I don't know if I left enough time. Looks like I didn't. For questions now, since I won't be here. I have to go home back to Seattle tonight. So I appreciate your attention. Thank you.